Hello, everyone. Hope everyone's having a great week. Well, today we bring a medical doctor, functional medicine doctor, Dr. Greene, who herself has tried BHRT and all these things that we've been talking about for the last few weeks. And we're going to understand how functional medicine can be helpful for women's health on a general level, since we are focused on perimenopause, but we will also touch on some of the menstrual health. So welcome, Dr. Greene, and maybe you can introduce yourself a little bit. I know I didn't do a very good job in introducing you and talking so much about your work.
That's okay, Amita. It's very nice to be here. I appreciate it. I was trained in traditional medicine and surgery, and I did surgery for many years. My background is in podiatric medicine and surgery, and I went on after I graduated from my residency to study a lot of alternative medicine and functional medicine and nutritional functional medicine and applying that into my practice. And I started working with a lot of chronic pain and a lot of autoimmune conditions very early on. So I branched out into a lot of different directions to help people with really chronic illness. And it's been exploding and exploding over the years. So I have my own history, deep history with menstrual issues from early on. I was diagnosed pretty early on with a severe case of endometriosis and severe adenomyosis, which is just a swelling of the uterine lining. And so I had really, really painful menstrual cycles where I would miss school, and I got put on birth control very, very early on, and I was on it for many, many years, and I was okay for many years. And then sure enough, needed a surgery and had a laparoscopy. And I had that surgery, and then I ended up having another surgery after that. It's exploratory because my pain was just out of control. I actually ended up on bioidentical hormones for a period of time just to try to manage what seemed all to be hormonal issues. And I think that's where it brings us to now, is that the symptoms that women have that seem like perimenopausal, menopausal issues like, hot flashes, night sweats, anxiety, depression, weight gain, headaches, digestive issues, and everything is hormones. It's all hormones, and we all get thrown into that big bin of hormones. And I don't think that is honestly the root cause. Now, when we go into menopause, which should be a natural process, it always used to be for women to go, and hormones naturally reduce at that time. And it doesn't mean that we're supposed to keep giving more exogenous hormones to people. It could, give them temporary relief, but a lot of times it's not lasting. And it also doesn't fix all the different issues that women have. They might feel a little bit better. They also change their diet, which actually helps them to feel a little bit better. But ultimately, we haven't looked at and delved into a little more of root cause of what these different issues are being caused by. And to me, it's more of a lot of high toxic load. It's liver issues. It's adrenal issues. It's heavy metals, toxic heavy metals. It's viral issues. So there's lots of things that kind of take our body down and seem to throw everything out of whack and out of balance. And of course, our hormones can get affected by this, but there's ways of doing things more from a natural perspective. You can also do lots of functional medicine testing, and you can do tests for hormonal panels and look at hormonal panels all the time. But what happens is it's just a snapshot, right? It's a snapshot in time, and it's not really telling you what is going on even during that one day. There's so many fluctuations that our hormones have throughout the day, throughout the month, and it's very hard to treat hormonal imbalance by looking at a snapshot of blood work, or even if you're considering doing saliva testing, even that has been shown to be not as effective. So I think that, testing is important to get some baseline parameters for people, but I don't think it's the be all end all to help somebody to, work through all of it. And like I said, hormone replacement, if that's something that you desire and your practitioner desires, it could be a bridge. But if you don't deal with the liver issue, the toxic load, the pesticides, the herbicides, the fungicides, the DDT, all of these things that are causing issues with our bodies, that we can't really get through all the different symptoms that are happening. It's temporary fix. It's another Band-Aid. And we don't want to do Band-Aid medicine. We really want to get to the underlying root cause for people.
So I think that makes complete sense. Just for, you talked about the functional testing, and we are all confused as consumers, me including. When you go to a functional medicine doctor, there's so many tests, so maybe you can talk about what are the different tests they're talking about, just for educational purpose, we know. And like Dutch test, right? It's very expensive, a couple of $1,000s. It's a complete panel, hormonal panel. Then there's all kind of testing. So just give us a couple of minutes of what testing, what they're doing, and whether we should do, I'm talking about the individual test here.
Yeah, I mean, listen, I don't do the Dutch tests on patients, but I've read them and I've gotten them from other practitioners, because I usually get patients who've been through. It's very common for me to see a patient saying, I just went to 5 naturopaths, I went to 8 functional medicine doctors, and that's what happens. They go from specialty to specialty to find an answer. And they do organic acid testing, and they do all this essential fatty acid testing and toxic load testing, and they're doing stool analysis, and there's so many varied tests out there these days. And I think it does confuse patients, and patients want answers. So they like to see something on a piece of paper, right, that says, oh, here's my problem. And they want that, because it sometimes when you're just confused, you just need somebody to say, oh, point it out, that's what's going on. And then you have a sense of relief. But a lot of times those tests may look like they're giving you answers, but they're not. So I'm not an expert on the Dutch test. And like I said, I don't really prescribe that for people. I get stacks of things from patients. But I think that it can be done a lot more simply for patients, where they don't need to spend thousands and thousands of dollars. I used to do a lot of food allergy tests, and it was just off the charts that people would be allergic to so many things. But that really, what happens is it's triggered. The allergies get triggered on all these different tests because you have this toxic load, and it's not very accurate. But we can also say, obviously there's ways to do elimination diets with patients, and, sometimes they don't want to do an elimination diet because they want to know, well, because it's hard to change our diets and our food. But I can tell you that there are specific foods that are going to boost your immune system, and they're going to support the reproductive system. And if you use them therapeutically, and you use them in a manner that's using food as medicine, and you're using herbs to help people to get back into balance, and you're looking at lifestyle medicine, you're looking at people's adrenals, the adrenal fatigue and the adrenals that are tanked, especially if you've gotten COVID, if you've just gotten a flu bug or something, your adrenals take a hit. And so everything can get thrown off just from that alone. So, a lot of people who are suffering from long COVID, they're looking at, adrenal fatigue now as well. And they don't even realize that. So there's the viral piece, there's the toxic piece. And so I think that if you worked, patients really understood a little bit more in depth about their diet and the importance of food and how to use it. Not ascribing to say, well, I'm going to be paleo, I'm going to be vegan, I'm going to be this, I'm going to be that, or whole food 30. I think it's so confusing to patients. They are so confused by the different information out there. In my experience, I see people that are on too high fat, too high protein, and that slows the process down. It really, really does. And I know when I change that for people, I see a lot of results. So as far as testing, doing some baseline tests are great to test, but I'm somebody who says, get just the basics. I don't say you need all these other fancy tests. And I think it has been working well for me for 30 years now in practice.
So that's great. So I want to talk a little bit about the BHRT, right? So now you mentioned a little bit menopause as being a natural process for all of us. And now the hormones are going to deplete at that time. And now
Right.
there's a lot of research that talks about, well, if and we don't know, again, that's again confusion, right? From a consumer point of view, I'm completely confused. They
Yep.
say, oh, your estrogen's gone, your progesterone gone, you're going to end up osteoporosis,
Osteoporosis.
right? Assisted living care, all kind of scary stuff.
Yeah,
If you don't do DHRT or HRT or whatever, your
correct.
comments and feedback, because we as consumers don't know what to do.
So here's my, that's a really big topic, and I could talk for a long time about that. And I'm going to say that I don't feel that hormones, and this is a big controversial statement to make, but I don't feel that hormones are the cause of our osteoporosis. I believe, or osteopenia, osteoporosis. This starts years in advance for people. Their diets are way too acidic. We have a lot of caffeine in our diet. We have too much alcohol in our diet. We have things that actually pull calcium out of the bones when our body is more acidic. And we tend to have more of a higher acid diet, and viral pathogens cause acidity. Toxic heavy metals cause acidity. So we start losing calcium early on from the bones and losing the bone density. And if it would just be addressed in a different way, I think that it's not a hormonal thing. I think there's I have women coming to me all the time with osteopenia, osteoporosis, and watching and looking at their scans and watching things go bad. But when you start to really give the right silica, the right nutrients to start to build bones and teach them how to remineralize their teeth and their bones, their whole skeleton, things start to change. It takes time. It's not a quick fix. We are a society that wants quick fixes, but if we work with these things really diligently, stress is going to start to cause bone loss, too much ongoing chronic stress, right? So I believe personally that it is not the estrogen and the progesterone lowering that is causing osteopenia. Do we need to exercise? Yes. Do we need to do, resistance types exercise? 100%. We need to, work on our skeleton in that way. The stress response is really important.
So your thing would be to focus on food as medicine. That's what I'm hearing, right?
And I can tell you, I'm going to tell you just a list of the top foods.
Sure, please.
Because I think it would be beneficial for people to know that will boost your immune system and support the reproductive system. Brussels sprouts, broccoli, wild blueberries, cauliflower, butterleaf lettuce, has a lot of omega-3s, by the way, red leaf lettuce, bananas, melons, papayas, lentils, hemp seeds, blackberries, celery, mash, artichokes, tomatoes, red bell peppers, asparagus, apples, spinach, black grapes, cucumbers, tahini, and avocado. And so all of those foods are amazing for the reproductive system. And then, we talk about herbs, and herbs are phenomenal, like using ashwagandha. And usually women need to be on a methylated folate, and they need to be on a B complex, and they should be on curcumin, and they should be on some lysine and magnesium and dandelion root and red raspberry leaf. There's so many ways of working with somebody to look at their whole picture, because we can't just look at hormones, right? We have to see, when I take a symptom list of when somebody comes in, there's usually 10 or 20 symptoms that somebody is struggling with, and they accept that they have to live with this, but they don't.
Okay, I think this is very, very intriguing, the way you are thinking, and as opposed to other MDs, doctors that I have interviewed. I want to open it up for questions and feedback. I know Sana and Angela, we have two attendees. Do you want to comment, ask question, any feedback?
Hi, my name's Sana. I'm a GP trainee based in Manchester, UK. I'm actually quite interested in functional medicine and lifestyle medicine, which is why I've attended this. I was just wondering, are there any papers based off, regarding what you just mentioned right now about osteopenia and osteoporosis? after menopause, because over here our guidelines are bisphosphonates, and of course you need to have DEXA scan, this, that, etc., etc. So it'd be nice to know if there's any evidence about.
Yeah, you know, unfortunately, there is not a lot of research, quote unquote, like studied research out there right now, mostly because there's not enough funding to do this, right? So medicine is where the funding is, big farm, right? That's where medicine and studies get taken out and or get done. And unfortunately, there's not enough. So there's a lot more anecdotal stuff right now. But I don't know about, I'd have to look a little more into the osteoporosis type of papers and what might be out there. The American College of Lifestyle Medicine, they have a lot of resources for nutritional based medicine and using food as medicine. And there's more coming out now. And I believe within the next 5 to 10 years, there will be more. It's really the funding that just are not able to give you a double blind crossover study to prove and show you what I'm saying. I can only say by looking at what people have done for themselves in my practice and other people who follow this way of learning. A lot of this, so just as a lot of this information that I got introduced to about back in 2015 was by a gentleman by the name of Anthony William. And I don't know if you've read any of his books, but he talks a lot about this. And that got me really, really fascinated on this topic and many, many other topics on what he's speaking about. And it when I started to read his books, it all just completely made sense. And there were missing pieces in my practice that changed everything.
Thank you.
Sure.
So to summarize, your mantra is really focusing on food as medicine, using herbs, using exercise, meditation, yoga, and that as a first line of defense rather than
getting to the root cause, really trying to get to that root cause of what the problem is for that person. So yeah.
Got it. I do want to ask Sanam, because I've interviewed quite a few GPs from UK, and in UK it sounds like, at least my impression is, anyone who's going through menopause, they are automatically going to HRT. Do you want to comment a little bit on that? That's what I've heard. Now, I could be completely wrong, but I've interviewed quite a few of them.
It's just, it depends on patient's choice. So there's a lot of awareness. And if someone's interested in HRT, they do come to us. And it's usually about physical symptoms. For example, dryness, if they're trying to have intercourse, it hurts, it's dry, or multiple urine infections. So when postmenopausal women come in with, for example, that's where we initiate it, is when they come with multiple recurrent UTIs, and when you explore that, we find out that they do have dryness and they do benefit from vaginal estrogen. So that's where we initiate.
So it's interesting, and I hear you with that, because that's what we do here as well. And I would say one of the main culprits behind vaginal dryness is adrenal dysfunction. And when you start to learn how to really support somebody's adrenals with food and supplements, you will start to see changes over time. Now, it takes time for the adrenals to come back on board, but I understand it's a huge problem for women, but when you really address the adrenals, you will get that a lot more of that going in the right direction.
Quite interesting. I haven't heard about that. I'll have a look into it.
Look into it. Feel free to contact me and I can give you some more information on that as well. And what to do specifically, but it's powerful. Food as medicine is very, very powerful. It's just, there's so much conflicting information out there that doctors are confused. They're just so confused, right?
Yeah, that's right. Yeah.
Amita, I'm going to have to go because I do have a patient.
Yes. But yes, absolutely. We're going to wrap up. Thank you so much. This is a quick 10-minute session. I know both of you are doctors. Thank you so much for your help. And thank you so much for all the information and educating and lifting some of the fog that all of us have. Yes, absolutely. You share your website, anything, please, so that people know.
Sure, people can just go to Dr. Sherri Greene. It's Dr. D Sherri SHERRI GREENE .com. You can find me on exactly at that on Instagram. I post a lot about Instagram. I have a great post on osteoporosis there. Yeah, reach out.
Thank you. Thank you so much, Sana. Thank you. Bye-bye.
Nice to meet you, Sana.